Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Today on Community Health Heroes, we'll be speaking with Dr. Brent Nick, a pediatrician with Daughters of Charity Services of New Orleans, who will talk about the importance of back-to-school physicals for kids. Jim Pittman with the Smoking Cessation Trust, who will give us an update on the trust progress around the state of Louisiana. And Christian Sagne, Vice President of Communications and Public Relations for the New Orleans Convention and Visitor Bureau, who will talk about the many restaurants participating in this year's culinary promotion, including some featuring healthy menu options. And on today's Eat Fit NOLA cooking segment, we'll be in the kitchen with Liz Ford, founder of Root and Arrow, a 100% organic, plant-based meal delivery subscription service. So don't go away. We'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome to Community Health Heroes. While kids are continuing to enjoy their summer vacation, parents are starting to hear the chime of school bells, signaling that it's time to start preparing their little ones for their return to school. Joining us today to talk about the importance of back-to-school physicals is Dr. Brent Nick, pediatrician with Daughters of Charity Services of New Orleans. So welcome to the show, Dr. Nick. Can you tell me, parents are obviously getting ready to send their kids back to school. Can you tell me about the importance of annual physicals for our children?
Well, they're very important. Strongly recommended by the American Academy of Pediatrics. It's a great way to maintain your relationship with your primary care physician, specifically your pediatrician, and to maximize the opportunities for your child to be healthy and happy.
And they can look at things like if they're having any behavioral changes or sleep changes or any concerns that the parent has.
Yes, board certified pediatricians are going to evaluate all aspects of your child's life and health, and they're going to try to find ways to help you be the most efficient parent you can be.
Absolutely. So they're not mandated, but they're strongly recommended.
They are strongly recommended by the American Academy of Pediatrics, starting at age 4, yearly visits.
Okay. And so it's really important also call your doctor in a timely manner so you're not putting off to August 1st, correct?
Well, some of us are better at planning than others, but with a little bit of effort, we can assist you in making sure that you get those annual visits.
Okay, I appreciate that. Now, should a parent provide a list of medications to the school? Is that important or not important?
Well, it's very important, as well as any severe allergies that the child may have, any food sensitivities, any insect allergies or sensitivities to any kind of food that they may become exposed to in the school environment. And that's just a good thing to have on the child's record.
So medications, allergies, and like you mentioned, even like insect or other type of environmental allergies. I hadn't thought about that one. That's a good one. So how should they talk to the teachers about like allergies? You know, if a kid has a party at school and, you know, the obvious one, a lot of nuts or some of them are allergic to eggs, how should they approach the teacher so that they know that this is an issue? Well,
just like having a definite and consistent relationship with your pediatrician is important, having a definite and consistent relationship with your child's teachers is very important. And so that's the kind of thing you want to have in your initial conference with your teacher. And it shows and demonstrates that you're actively interested and involved, and that's the kind of thing that the school system loves to see.
And it's also important with the medications that they have certain forms. Every school has a different form they want filled out, but they really need to make sure that the medications is in the office, and also that the form is filled out that the school can administer it,
Sure,
correct?
sure.
Okay.
Most schools have some kind of form that you have to fill out on matriculation of your child into the system, and usually those things have to do with the health history and vaccination history and the allergy history and that sort of thing.
So as our kids get their annual physical, how do they know what immunizations are required or recommended?
Well, nowadays we have a system called the LINK system, which allows us instant access to your child's entire vaccination record, no matter where in the country they receive their vaccinations. Even on the vaccination buses, we get information from.
So can you tell me a little bit about the vaccination buses?
Vaccination buses are provided by several organizations throughout the state, and they help to make an outreach to those parents who are having difficulty times getting to a standard clinic.
And they can provide the physical and the immunizations?
Principally the immunization, not so much the full physical. And they've become just a great thing for our community on a whole, because it just provides the parents with another venue to keep their children as healthy as they can.
And so if we want to know more about Daughters of Charity or these vaccination buses, where would we go for that information?
Well, we have an excellent website that's easy to use, dcsno.org. And you can also call us directly at 504-207-3060.
Awesome.
And our staff are ready and willing to help you to answer all those questions for you.
Now you've grown tremendously. How many locations do you have now?
Well, I haven't grown that much. I'm working on my own diet and physical activities, but Daughters of Charity is growing in leaps and bounds, and they now have 9 clinics that cater to the pediatric population, and we extend all the way from Kenner to East New Orleans and on to the West Bank, where my primary location is. And
you also not just take care of the child's well-being and immunizations, but you still have dental services and other information available.
You know, Daughters of Charity is working hard to become a health center, a distinguished health center, and so we are providing all aspects of health care for our patient population, not just the pediatric patients, but our adult patients as well. So we like to think that if you come see us, we'll be able to make it happen for you.
Kind of like a patient-centered home.
Yeah.
Awesome.
We can do it all.
Thank you so much for being on our show today and providing this valuable information.
Well, I really appreciate you inviting me.
Thank you. And when we return, we'll be speaking with Jim Pittman of the Smoking Cessation Trust about how you can take that first step to quitting cigarettes. So don't go away. We'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
While nearly a quarter of Louisiana residents, 24% to be exact, continue to smoke, thousands of eligible people in Louisiana have made the commitment to quit cigarettes by becoming a member of the Smoking Cessation Trust. Joining us today to give us an update on the program's successes across the state is Jim Pittman, Community Outreach for the Smoking Cessation Trust. So welcome to the show, Jim.
Thanks for having me, Dr. Walker.
So the Smoking Cessation Trust is doing just absolutely incredible in Louisiana.
It really is. We've been averaging just in 2016 about 1,900 new member applications per month.
That's huge.
To date, we've hit over 56,000 applications, of which 54,000 have been approved, so 96% are being approved. We're very excited about the program. I think the state is very excited. I'm glad to see that so many smokers see the benefit of this wonderful free program. We've been lucky enough to partner with major healthcare providers throughout the state, most recently with East Jefferson General Hospital, Of course, we partner with Oxnard, we partner with West Jefferson Medical Center, the Daughters of Charity Health Centers came on board recently, Cardiovascular Institute of the South, Willis Knighton in Shreveport, Imperial Health now in Lake Charles is a new participating provider. So we're just thrilled, and if you go online, you can see a long list of those healthcare partners throughout the state, and so we're thrilled to have them.
Well, tell us a little bit about the program, because not everybody even believes that medications are included in it, or that you get counseling. So it's just a fabulous, well-rounded program. So tell me about that.
It's a wonderful program that is free for any smoker that lives in Louisiana and started smoking before September 1st, 1988. It includes group counseling, individual counseling, nicotine replacement therapy. It includes prescription medications, and if anybody has tried to quit and price prescription medications for cessation, it can cost up to $300 a month out of pocket. It also includes quitline therapy, and of course all these wonderful providers that are working with us throughout the state.
And you're funded for how many more years?
We're funded, we're in the 4th year of the program, so we've got about 6 more years to go. And we're hoping to enroll about 200,000 smokers throughout the state. So if you know anybody that smokes that started before September 1, 1988, they can go online at smokefreela.org. They can call us at 855-259-6346. We're very active on social media, on Facebook, LinkedIn, Twitter, YouTube. We've got wonderful testimonial videos on YouTube from people who have actually gone through the program. So
Are they just like Google like Louisiana Smoking Trust, or what would, how can you find it?
If you Google Smoking Cessation Trust or Smoke Free LA, you'll find us. But we're very easy to find on all the social media platforms. And again, on our website, we list everything as well, and that's smokefreela.org.
So Jim, this is such a phenomenal program for the whole state of Louisiana. How can we continue to get the word out?
I'm so glad you asked that, because one of the challenges we have is that we're not allowed to advertise. All the money that's in the trust goes to helping people quit smoking. So we rely very heavily on word of mouth. So, if and anybody in your audience knows anybody that smokes, whether it's a child telling their parents or grandparents about the program, grandchildren telling their grandparents, we rely very heavily on social media, influence networking, any doctors, nurses, anybody involved in the healthcare community, to tell their patients about this wonderful free program. One of the things we would love to see is more employers throughout the state take advantage of this and make sure that they're letting their employees that smoke know about the wonderful program, because it's a challenge to get the word out without being able to advertise. So the privilege of being on your show today really helps a great deal.
And the employer groups are coming to the carriers, and they're hearing about it, and we're able to connect them with each other. So it is getting out that way. But I think your testimonials will help tremendously. I mean, knowing that they're out there and our folks can watch them on YouTube, I think that's just a phenomenal way of getting this information out.
Absolutely. They can watch the testimonials on YouTube, or they can go to our website at smokefreela.org. So please look us up, follow us, like us, share. We appreciate all that, because we want to help 200,000 Louisiana smokers to quit. And just imagine the health and economic impact for the state of Louisiana if we can get 200,000 people to quit smoking. Because I think the last thing I saw was 1 in 5 people die from cigarette smoke. And then when you look at the state struggling with the budget these days, and the last numbers that I saw from the Department of Health and Hospital, smoking related health care cost the state of Louisiana, people in the state, about $1.9 billion per year. And there's another $2 billion a year or so that is lost due to, lost forced
Absolutely.
productivity due to
Right.
people who smoke, who tend to be sick a lot more often than others.
Right.
So
It's related to heart disease, diabetes,
almost every
emphysema.
major
Absolutely.
illness is related, and those are other people that I try to, and that we try to relate to and to try to meet with as often as we can. The folks at the American Cancer Society, American Heart Association, health insurance providers, because all of them can certainly see the benefit and can certainly help us get the word out.
And it's free.
And it's free. And all you need to do to enroll is go to our website, smokefreela.org, or call 855-259-6346. It takes maybe 3 minutes to enroll. And if you're a Louisiana resident and you started smoking before September 1st, 1988, and want to quit, here's your opportunity, because it is the only program of its kind in the country like this.
Absolutely. Well, Jim, thank you so much for taking the time to be on our show today.
Thank you. It's been a pleasure.
When we return, we'll be speaking with Christian Sagne, Vice President of Communications and Public Relations for the New Orleans Convention and Visitor Bureau, about their annual culinary promotion. So don't go away. We'll be right back with more Community Health Heroes.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
2 outs with a runner on first base. Now the big guy comes off the bat, hitting .342 with 92 RBIs and 36 homers. The first pitch is fouled into the bag.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
In other cities, people eat to live, but in New Orleans, we live to eat. Joining us today to talk about the annual culinary promotion is Christian Sagne, VP of Communications and Public Relations for the New Orleans Convention and Visitor Bureau. So welcome to the show, Christian.
Thank you for having me.
So tell me, how did this culinary get started?
So 12 years ago, culinary was started as a way to get locals to dine out more, because August was historically a really slow month. It's the heat of the summer. People are staying indoors more, so culinary was born to get people out and about and spending money in the city.
So mostly was it focused on restaurants or just getting them out to spend money anywhere in the city?
It was mostly about restaurants, but if you go to the website now, you'll see you can book a hotel room too, so you can be have a total tourist experience in your own hometown.
That's awesome. So what kind of events or what kind of promotions do you have going on?
So throughout the month of August is culinary, August 1st through the 31st. You can find discount deals for 3-course dinners and brunches across the city for $39 or less.
Wow, where do you find that at?
You can go to culinaryneworleans.com
Okay.
and see all these offers. So it's not just dinners and brunches, we also have lunches, 2 to 3-course lunches for $20 or less.
Wow.
And some of these restaurants are top-tier restaurants in the city. Some of these restaurants are some of the best in the city, so you can really go there at a discounted rate and enjoy 2 to 4 courses for
And
a
you
really
also
good
could
price.
hook up a hotel room if you wanted to stay in town and really enjoy yourself.
That's right. You can make your reservation for your hotel room and for your meal. And there's also a feature on the website for lagniappe offers. So at some of these restaurants, you can get a free Uber ride, or you can get a flight
my
of drinks,
gosh.
or there are extra little lagniappe specials for each of these.
Awesome. Now, you know, we're trying to get a little health conscious in the city. We're not just like living to eat, but we eat to live here. So can you tell me about, are there some Eat Fit NOLA restaurants that are in
There
this
are.
program?
We're happy to have some really healthy options through Eat Fit NOLA. Cafe Degas is one that comes to mind. They offer an Eat Fit NOLA offering. Cafe Adelaide as well, and
I
all
love
the
that
Dickie
restaurant.
Brennan's restaurants. And
Wow, all of them?
all of them.
Oh my
So
gosh.
that's a really interesting thing too. You don't have limited options for Eat Fit NOLA or for culinary. We have 53 restaurants signed up so far.
Wow.
Last year we had more than 80, and we're expecting to get the same response from restaurants this year. So our restaurant community really gets into this, which is great for the diner.
And how have you been getting the word out?
We've been reaching out to our members, the CVB members, to see if they're interested in participating in culinary, and we're in our 12th year now, and it's developed a bit of a reputation. So we have a great response from our members saying, yes, we want to be involved. Here's our menu. Put us on the website.
Wow. And so the website again?
culinaryneworleans.com.
culinaryneworleans.com. Well, that is awesome information. And we do love to eat here, so let's get out in August and try those restaurants.
We've just made it easier.
And cheaper.
That's right.
Well, thanks so much for being on the show today. Really appreciate it.
Thanks for having me.
When we return, we'll be speaking with Liz Ford, founder of Root and Arrow, a 100% organic meal delivery subscription service, when she joined us in our kitchen for another exciting Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
She took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back. Joining us for today's Eat Fit NOLA cooking segment is Liz Ford, founder of Root and Arrow, a meal delivery subscription service that directly delivers organic, fresh, clean, seasonal, and local when possible ingredients to nourish your mind, body, and soul. Thanks so much for joining us today on the show, Liz.
Thank you for having me.
So what are you preparing today?
Today I am preparing a watermelon feast.
And what is in this? Yummy, it already smells good.
Watermelon, it is zucchini, cucumber, strawberries, watermelon, avocado, a fresh lemon vinaigrette, and everything is topped with fresh mint.
And what is this cool little tool that you're using to make this?
This is my favorite tool. This is a spiralizer, and it takes anything and makes some vegetable noodles, which is really nice, a different texture, so it's not as chunky.
So you could either eat this raw, or if somebody wanted to, they could like gently steam them.
Correct.
Awesome.
Yes. Yeah.
And how did you come up with that name, Root and Arrow? It's such a different name.
So I knew what I wanted to do with the company before I started it, and I was struggling with the name, and I wanted plant-based nutrition delivered to you. And after a lot of thought, Root and Arrow came up to me. So Root is plant-based, and Arrow is delivered to you.
Awesome. And most of the items, or all the items, are Eat Fit NOLA?
All items are Eat Fit NOLA.
Awesome. And then this is vegan.
Yes.
And also, is there any gluten in this?
No gluten at all. Everything is vegan, organic, and gluten-free.
And so if somebody was really interested, how many meals a day do you prepare for people, and how often do you deliver?
3 meals a day, breakfast, lunch, and dinner, and I deliver on Sunday mornings and Tuesdays.
And it's completely prepared for you. You don't have to do anything.
Yes, so everything is going to come in this container. All you have to do is dump it, shake it up, and enjoy.
And so the salad dressing, they're inside there?
Yes, they're in there. Down there
that's
at the
very
bottom.
cool. And how many items do you have on your menu at any given time?
15. So I do Monday through Friday, breakfast, lunch, and dinner. So everything's set, and you pick and choose which day and what combination of meals you want each day.
And you definitely have some breakfast items?
I do. So this right here is our raw cranberry muffins. People tend to really like the breakfast items, and they order actually quite a few of them.
So if you wanted to have like 2 servings, you could substitute
You can. You can't do that per se through the website, but just give me a call or email me through the website, and I'll take care of it.
And how long have you been partnering with Eat Fit NOLA?
About 7 months.
Wow. Okay.
Mm-hmm. So I'm adding just a little bit of salt to a freshly squeezed lemon and olive oil, and then a little bit of garlic because it'll kick up the flavor. Shake it up, and then we're almost done.
Awesome. It looks very fresh and very colorful. I'm going to just move this out of the way so
Thank you.
our audience can see this beautiful salad.
And then there you go.
And then every quarter you change the menu up based on what's available?
Every season we rechange the menu with seasonal items. That's how we can focus on that. That being said, we do change our menu also every week, so people get a variety in their diets and they're not eating the same thing every week.
So you change your menu every week and then every
another
quarter?
overhaul every quarter.
Wow, that's fascinating. And how could we find out where to find your services?
www.rootandarrow.com. Or
is it an and, like
A&D, everything spelled out.
Rootandarrow.com.
Yes, or give us a call, 504-444-6504.
And what else do you have here for us?
So here I have our Mediterranean salad. It's greens, it has a Greek vinaigrette, and then a zucchini hummus. So some people have bean allergies, and I try to take it out sometimes. So that's with zucchini. It has quinoa, cucumbers, sun-dried tomatoes, and olives. And then this right here is our Thai salad. It is kale with an almond butter dressing, and then it has curried cashews and raw carrots.
Ooh, tell me about the curried cashews.
The curried cashews, that's just fun. It's carrots, and you toss them in curry, green curry paste, cumin, and a few other spices, and just roast them in the oven. And they're good. They're perfect topping. And then we also have our raw cranberry muffins, which are our client's favorite. It's just an even amount of dried cranberries and dates to cashews and almonds, and then it has a little bit of citrus with orange and vanilla.
So you are getting your protein, like in the breakfast, you get your protein.
You are.
The cashews.
And because we don't have meat per se, we focus a lot on fats, so you're still full the entire day.
Awesome. And this diet is also, or these meals are also healthy for other things, like you were talking about earlier, like diabetes, cancer patients.
Yes, autoimmune diseases, people with diabetes to kind of help regulate the blood sugar, and then heart health, just overall eating more vegetables in general is going to be really helpful for them.
Great. So Liz, this is just a fascinating concept. How did you come up with this whole idea?
So I used to be an attorney. I would work long hours in the office, and I wanted a company that delivered fresh food to me and focused mainly on vegetables and organic food, and we didn't have it. And so I was actually let go from my job, and instead of worrying about anything like that, I decided I'm gonna use this opportunity to do exactly what I want in the city, because I love New Orleans, and I felt like it's a way that you can help the city and give back.
So there's definitely an opportunity. Nobody else was doing this.
No.
And you were telling me earlier before the show that you would bring these things to work.
Right, I would bring them to work and people would ask me, what are you eating? And y'all need to try this, it is so good. It's just simply vegetables, and it's so easy and so fun what you can do with them.
So tell me about Fresh and Clean. And there's a lot of ingredients that our population may or may not be familiar with. And you mentioned like quinoa and some other cool things. Tell me about that.
So Fresh and Clean basically means I make everything from scratch. My dressings, I make everything from scratch. I start with the olive oil, add the citrus, add the vegetables, add the fruit. I just want to bring to people the cleanest ingredients I can, and fresh in that I buy my ingredients the day before I produce everything, and then I deliver right after I'm done producing. So it's the freshest, straight from the store, kind of to your house. And the cool thing about quinoa is it's naturally a gluten-free grain, so I don't have to worry about finding it gluten-free. It's a grain kind of like rice, except it has a lot more protein, and it's more balanced with the carbs to protein.
So you're not going to have the blood sugar shifts.
Right. It's great to help even out your blood sugar.
Awesome. Well, thank you so much for providing us food and this information for us today.
Of course. Thank you for having us.
And we'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us today. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com, or visit our website, www.communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.